Hello doctor, this is Efren Colasso for the video of the shoulder exercises rehabilitation and some adaptations of the classics exercises that includes scapular motions and the integration of the kinetic chain with the trunk and with the lower extremity. The first exercise that I'm going to pick is the classic YTI exercise, but then I will do some adjustments to those exercises. The first thing that I will do is do the same exercises in the Y position. I stay in there, and then in this position I will do the scaptions, and I will try to improve that middle translation of the scapula, and at the same time doing the downward rotation and the posterior tilt. So I will do 3 sets of 10 in the Y position, and then I will do the same with the T position and the same in the I position, concentrating all in the scapular motions. Then I would progress those exercises with more trunk extension, more dynamic exercise. The same with the I, the Y, the same with the T, and the same with the I. Okay, Y, T, I. Then I could do the same exercises doing different motions of the rotation. So I can work the Y in here and then work the Y with empty can motion and all those adaptations. And finally I would do more integration of the lower extremity and more dynamic exercises, maybe the same position that we put the legs when the throwing motion. It's a little bit of a 90-90 position, and in this case I'm going to throw with my right shoulder. So I'm going to do a hip extension and knee extension, and I will do the same with the Y, trying to focus in here, and then the Y. That's the first one. The second exercise that I'm going to pick is the rowing exercises. I know that you explained that in the modules, but I really think that this is a great exercise for working shoulder rehabilitation and at the same time including the scapular motions and the lower extremity. So first, for the rowing exercises, I would start with the classic exercises, including the scaptions. So I would work in here, 3 sets of 10. Just first in the 90-90 position, only concentrating in the scapular motions. Again, trying to improve that posterior tilt, medial translation of the scapula, and downward rotation. So after doing that, I would integrate a more dynamic exercise, always concentrating on the scap motions first, and then I would progress it to the trunk extensions. Finally, I would do single arm exercises, row, and then I would include with trunk rotations, maybe first in a bending position, in a flexion of the trunk, and then I would do that in more stabilization exercises when I would do the row and the external rotation. Again, working the first exercises, working on a base of 3 sets of 10, maybe 3 sets of 12. Then the more dynamic, more complex exercises in the kinetic chain, I would do 3 sets of 15 until the patient have good control of the exercise. The last video I'm gonna pick are the slides. I really like that exercises in the modules, and I really think that they're really good for working the rehabilitation shoulder, proprioception, and more functional dynamical movement, where we can work our shoulders, our scapular area, scapular zone, and then adding this kinetic chain correlation for the exercise. So I definitely would gonna use these exercises in my rehabilitation programs. So I really understand that when we are going to do these exercises, it's not only doing the arm motion, it's trying to go as far as you can and then doing that scaptions. And for advancing this, trying to integrate more our zones, our kinetic chain, well, we can do the exercise while doing more trunk flexion. And then I would add trying to do in a three-dimensional way. So I can go across, trying to use that scaps. If you see here, I'm just only doing the motion. It's not the same that if I do this with the scaption, with contraction of all the muscles in the scapular zones. So definitely doing that with a little bit of trunk flexion and doing all the motions that, again, is gonna try the better stabilization, moving the scapula medially lateral motion, the posterior tilt, and the downward rotation. So I would do it in flexion. I would also do it in horizontal abduction, and then doing different places, so I can do that dynamically and at the same time using my trunk to have more this kinetic chain correlation.